can tell I'm very excited for this. So I'm just going to read a little bio to introduce her, and then we'll get started. So thank you for joining us, Colleen. So Colleen is a licensed naturopathic doctor working in Miramichi, New Brunswick at the Miramichi Naturopathic Health Clinic. She has been in practice now for 4.5 years. Dr. Leonard was raised in Miramichi, so she is happy to be able to get back to her community in a healthcare setting. After graduating with a Bachelor of Science and honors in psychology from Dalhousie University, Dr. Leonard started her path to become a naturopathic doctor. She attended the Canadian College of Naturopathic Medicine for the 4-year doctorate program and graduated in May 2017. Dr. Leonard works on the root cause of disease and helps connect the dots to obtain optimal health. Although she does not have a specialty, she works mainly with mental health, stress, hormones, and gut health, which she says are all interconnected in some way. Aside from work, Dr. Leonard enjoys spending her spare time outdoors, snowshoeing, hiking, camping, and spending time with her very cute puppy, Lenny, and her family. She is looking forward to growing in her career and has been enjoying the learning process thus far. So we welcome you, Colleen. Thank you for joining us.
Hi, thanks for having me. All right, so I can get started. Can you hear me? Good. Okay, perfect. All right, so hi everyone. So Brooke introduced me. So I'm Colleen. I'm going to do a PowerPoint presentation because I'm kind of old school that way. So I'll share my screen once I get started. If you guys have any questions, obviously interrupt me if you want, or you can answer in the chat and I can check them at the end too. So my plan today obviously is to talk about naturopathic medicine, and then kind of just go into the whole body approach aspect of things and how that might connect to autism spectrum disorders, and then just kind of overall, health picture and what we can do to really just, really improve your health overall. So I'm going to share my screen. Make sure that works. Okay, can everyone see that? Good. All right.
Great.
So, yes, and I am going to obviously link it into mental health, but I may kind of go off topic a little bit, and I apologize. I could talk about each individual topic for probably an entire couple hours for all of them. So it might be a little bit choppy, but I just wanted to cover some of the main points that I like to kind of discuss when it comes to mental health and naturopathic medicine. So a little intro. Brooke kind of gave you an intro already, but I was born in Newfoundland, but raised in Miramichi. So I moved here when I was 4. Graduated from Miramichi Valley High School in 2009, and then I went on to do my undergrad at Dalhousie University, where Bachelor of Science with an honors in psychology. So throughout my undergrad, I really definitely had a passion when it came to psychology. I knew I wanted something that involved A, helping people, but B, also that mental health component. I grew up in a bit of a medical family. So my dad's a medical doctor here in Miramichi, and my mom's a physiotherapist. So definitely my career path, I guess, was definitely healthcare promoted. And I looked into medicine, I looked into physio, I did, all the applications, I wrote my MCAT, I went through all those processes. But throughout that, I came across naturopathic medicine. I saw a naturopathic doctor for some health concerns, and really, really helped me. And I realized that as a career, it encompassed everything. It looked at the physical medicine aspect of it, the medical side of things, but then it also had this big mental health component of how, our mind and body are very connected. And it really just kind of spoke to me. And with the success that I had from being treated by 1-2, it just seemed like a good fit. So I ended up applying to the school. I got in and I went to Toronto on my own. My parents dropped me off. They were a little worried when they dropped me off because it was just, it was a new adventure. I didn't know anyone. I didn't really know what I was doing, but it felt exciting. So I started out, I did a bit of like a fast track program that I started in January instead of a September intake. So I never really had any summers off with that, but I attended it from 2014 up to 2017, graduated in the May of 2017, and then we write our final licensing exam that summer. And then I got my license and started practicing in November 2017 here at the clinic, and I've been here ever since. So, what is naturopathic medicine? So, I'm not sure. Maybe there's people here that have no idea what it is. Maybe there's people that have seen a naturopathic doctor. There's usually a variety of people that maybe they have an idea of what it is, but they haven't maybe seen one and that kind of thing. So, really, the definition per se of naturopathic medicine is that it's an alternative form of medicine. It focuses on finding your root cause of disease and treating the whole body. So, it's a whole body approach. We focus on head to toe. We focus on, okay, what are you putting in your body for nutrition? How is your mental health status? Is there something going on there that we need to focus on? How might that relate to your gut health, for example, and how your physical health is working? And then even down to the physiology of your body as well. So looking at blood work and figuring out what's going on internally, and then how that's all connected in the end. And that's kind of the plan with my presentation today, is to really kind of work through a little bit like from head to toe, and then to just kind of make it, hopefully it makes sense. Again, I apologize if it's choppy, and I'm going to try to keep it to an hour is the plan. If I have to cut some stuff at the end, I will, because like I said, I could talk for hours on all of this. So, naturopathic medicine, on our oath when we graduate, we have sort of 6 naturopathic principles that we follow. So, the first one is first, do no harm. So, obviously, focus on the least invasive options for you. What can we do? Yeah, what can we do to kind of help you, but maybe not have an overly invasive procedure or whatever it is in order to kind of get you back to the healthy lifestyle that you wish. Doctor is teacher is one of my favorite principles, as I'm doing today. Educating is one of my favorite things to do when it comes to naturopathic medicine, because I feel like there's just so much to know and so many things that people aren't aware of, and how it can help them in a lot of different ways. And even when it comes to like patient interaction, a lot of it is education. It's talking about, what foods you're eating and why maybe they're causing you some issues. Even just educating people on why they're on a certain medication that they were prescribed. A lot of patients come in and they don't know why they're on the medication that they're on. And then talking about risks and benefits and just lifestyle and everything. So it's really an education. A huge component of it is just educating on your overall health. Cooperating with the healing power of nature. So that is kind of dealing with, so our body has an innate ability to heal. So it already has this ability to heal itself and get through what it needs to get through. But when we add all the obstacles, we call them obstacles to cure, from whether that's environmental toxins, whether that's hormonal issues, stress, yeah, I mean, anything. It could be even your skincare products that are causing issues. Like there's so many factors that are going to kind of come in and disrupt that healing power of nature. So we really try to work on getting you back to that innate ability to heal yourself. Addressing the root cause of disease. So this is obviously the core principle, is figuring out, okay, why do you feel the way that you do? Not just, you have A, B, and C symptoms, and, this is probably what it is for each symptom. We want to know the why. We want to look from head to toe and figure out what's going on. So in our initial consults, we spend close to an hour, hour and a half with our patients, and really work through their entire health history from the day you were born to the present day, because we want to know what's happened to you and how that's maybe shaped you as the person you are, but also how that maybe contributes to how you're feeling overall too. Healing the whole person through individualized treatment. So this is really where it comes into play that everyone is unique, everyone is different. So it's not a one size fits all when it comes to your health. So I always give the example, I might have 3 patients that come in that are dealing with anxiety. They're all going to have a different treatment protocol in the end, because everything is different, right? Maybe the anxiety and anxiousness, whatever it is similar across the board, but there's going to be different reasons that they feel that way. So it's definitely not a one size fits all when it comes to your health. So that's a really key point that we like to kind of let people know too. And then teaching principles of preventative medicine. So really this is just looking at prevention. So if you come in and you've got a strong family history of cardiac disease, okay, well, what can we do? Can we improve your diet? Is there a supplement that maybe you could have that would prevent you maybe from having an issue down the road? So just looking at it from prevention rather than having to fix something once it's already broken, in a sense. So understanding our body. So I liked this little image I found online, just because it really looked at how widespread your health is. It's, again, I use the term one size fits all a lot, but it really isn't. We're all different. We're all unique. We all have so many different environmental factors that are going to come into play. So this really looks at everything. So, your healthcare routine, what you do for relaxation and stress management, your relationships with yourself, with food, with others, and how that comes into play with your health, your mindset. So what's your mindset towards your health? Is it negative? So if it's negative, then maybe we're not going to see any positive changes with that. Nutrition, which we'll talk about today, fitness, sport. So obviously exercise and how we move our bodies, how we take care of our body. So it just kind of looked at everything and how it's definitely not, it's not an individual thing. There's so many factors that are going to affect how you're feeling, and I think that's just a very important concept to understand, that there's always more to it. So I figured I would start by talking about some just basics when it comes to nutrition. Again, like I said, I could talk about this for hours too, but I'm going to try to keep it short. So nutrition, obviously, it's huge. What we put into our bodies is what our body is going to kind of give back out for us. You may have heard the quote, food is medicine. So, there's a lot of things we can do by just adjusting our diet and making sure that we're eating well. That might make a huge difference on how you feel overall. So the kind of standard, what we call, unfortunately called the SAD diet, the standard American diet, is that North American dietary lifestyle that is a lot of processed foods. So processed foods, high sugar, simple carbohydrates, high glycemic index, inflammatory. So when we think of that SAD diet, it's a lot of factors that it's, like white breads and white pastas and sugary drinks and pop and, not a whole lot of veggies and good quality foods and not a lot of healthy fats, more kind of unsaturated, unhealthy type of fats. High glycemic index means that it's foods that will spike your blood sugar really quick, but then cause it to drop. So it's not keeping it balanced throughout the day. And, the dietary lifestyles, there's enough research that can suggest that it's definitely going to be an increase in the possibility of developing a cardiovascular disease, developing diabetes, obesity, other conditions. So there's so many illnesses that can come from just what food we put in our body. The obesity rates in Canada are very high. I think they're up to like 34% of the population is obese. New Brunswick is like 38% higher than the Canadian population. So it's pretty severe. Like obesity is definitely a comorbidity for a lot of diseases. And I think it's a lot of that comes down to just either like lack of education of what to eat, affordability too. Like, healthy food we know is a lot more expensive. But it does come down to just not really knowing. What we see is what we think we should eat, and it is what it is. We don't get that education a whole lot unless we go specifically looking for it. So this type of diet can definitely lead to a lot of inflammatory issues and inflammation, which is kind of an umbrella term, but it can lead to a lot of different chronic illnesses down the road too. It's often a root of a lot of issues that we deal with, and the main source there is often when we do a little diet diary with our patients, we see that there is definitely a connection there that, okay, poor diet and they're dealing with joint pain all the time. Well, let's clean up your diet a little bit. Let's take some sugar out. Let's take some of those, processed foods out and replace them with some good stuff. And we might see a difference in your pain. And typically we do. So what can we do? So these are kind of my top recommendations when it comes to nutrition and what we can do to kind of improve it. So eat your fruits and veggies, fresh or frozen. It really doesn't matter. I get that question a lot about whether we should be, is fresh food better because the nutrients are taken out of it when it's frozen? Maybe a little bit, but nothing major. I would rather you buy the frozen fruit and the frozen vegetables if you're going to eat them, and they're going to last longer too in the end. And lately, probably more affordable too. Eat less simple carbohydrates. So simple carbs are things that are higher in sugar. So candy bars, chocolate bars, those types of things, but also like, a white bread and a white pasta versus a whole grain pasta or a whole grain, multigrain type of bread is going to be a little bit more complex carb. Other complex carbohydrates would include like root vegetables, like sweet potatoes, turnip, squash, anything like that. That's going to be more nutritious. And it's what that means is like a simple carb is going to have that high glycemic index effect that it's going to cause your body to spike its blood sugar and drop really quick, almost like a sugar crash, right? That we see that when we have candy, we feel great for a few minutes and then we crash. So complex carbs are going to keep that blood sugar stable throughout the day. And we'll talk a little bit about that later, how blood sugar might affect overall health too, and other factors that might affect your blood sugar as well. Clean protein sources. So really focus on lots of like nuts and seeds and your poultry and seafood. Seafood has a lot of anti-inflammatory benefits. Focus on beans and legumes. So like chickpeas, black beans, kidney beans, those types of things. Just try to increase those in your diet. Protein is very, very important. It's a building block for a lot of health issues. So we definitely want to, and just for your general kind of body development, eat more healthy fats. So, focus on, where we can find healthy options when it comes to fats are avocados, nuts and seeds, olives, olive oil. So things that you can just kind of add to your daily diet. And then reduce your processed sugar intake. So sugar is definitely a culprit of a lot of issues, whether that's behavioral issues, mental health related, physical health, whatever it is. It's definitely a culprit, and we definitely overconsume it in our population. And it's hard. It's hard when we're kind of addicted to sugar in a sense and we can't kick it. But it definitely has a lot of negative outcomes in the end. So Canada's food guide has actually come a long way. For anyone that's familiar with like past Canada food guides, their plate now is a very nicely balanced plate. So you can see a half of your plate should consist of fruits and veggies. They even have sweet potato and things there from that healthy carbohydrate, the complex carbohydrate side of things. Your protein food. So they've got some meat there, they've got some chicken in there, they've got your nuts, your seeds, they've got your beans, your seafood, all those types of things. They got eggs in there. So lots of good, clean protein foods. And then a quarter of your meal should have whole grain foods. Again, like a multi-grain bread. I think they have like quinoa. It's kind of hard to tell, but like quinoa and brown rice, and those types of things to try to kind of balance out your overall meal. And then making sure that water is your drink of choice rather than maybe a sugary juice or a pop or something. So really focus on the balanced plate. The Mediterranean diet is really often my go-to for a lot of patients because it's I consider it a lifestyle change, not necessarily a diet. I don't really love the word diet because I think there's a lot of negative associations with the word diet. So really in practice, we try to focus on like, this is a lifestyle change, right? We want to give you the building blocks to change how you eat and keep going that way so that it doesn't feel restrictive and it doesn't trigger a negative relationship with it. So the Mediterranean diet, there's tons of research on it for general health, but definitely cardiovascular disease, diabetes, obesity, those types of things, of it being fairly preventative of that. So its main focus on the bottom, you can see, so, enjoying meals with your family. So instead of sitting in front of the TV, sit at a table and, talk and enjoy your food. Get moving, get active, and just, be happy, I guess, in that sense. The next part of that really focuses on that. So there's healthy fats in there. There's all your fruits and veggies in there. There's your whole grains. There's your sources of protein in there. There's your nuts, your seeds, your olives, your avocados, your olive oil, all of those things. So a huge variety of that is going to be every day that we want you to have that in your meal. Then seafood. So they actually recommend seafood before poultry, just for more so its anti-inflammatory benefits and some other health benefits with it, but having that at least twice a week. And then your poultry, eggs, and some dairy products, having that weekly for sure, but in moderate portions. And then having reduced sugar, which we've talked about, and then actually reduced red meat. So red meat is a very inflammatory food. So we do try to stay away from that if we think there's some inflammation going on. So just a nice little, piece from the Mediterranean diet. They also recommend a glass of red wine every day. So who's going to complain about that? But it is a very good whole foods diet. So it's not restrictive. It's looking at overall health and it's looking at prevention too. So very naturopathic medicine of it. So nutrition and mental health. So I mentioned before, a lot of studies in relationship to your nutrition and that side of things. So there's lots of evidence of like significant cross-sectional relationships between unhealthy dietary patterns and poorer mental health status in children and adolescents. So the study was done in 2014, and it did find that, okay, there's an association there. If we're not eating well, then we may have poorer mental health. So that's, in my opinion, it's a huge finding, really, when you think about it, that what you're putting in your body could actually affect how you're feeling mentally too. And then data from adult populations indicated better quality diet associated with better mental health outcomes, and that there's actually a greater risk of depression associated with increased consumption of Western processed foods. So going back to that SAD diet, again, it's ironic. It's called the SAD diet, and it increases your risk of having depression. So that alone always stands out to me, because it's what we know. It's what's advertised. It's what's cheap too. It's a lot cheaper to buy all those processed foods, but in the end, it's not necessarily better for us by any means. Definitely isn't better for us. So I always just like to, yeah, kind of throw some points out there of how connected nutrition is. And again, it's what we put in our body is what our body is going to give out. We need to treat our body, you know, very sacredly, right? We need to know that this is what we have and this is what we were given in life. So let's treat it the way that it needs to be treated. So, a little bit kind of related to nutrition, but also kind of a side point when it comes to naturopathic medicine. So, food sensitivities. So, I'm not sure if a lot of you are familiar with that, but a food sensitivity, it's not an allergy. So, it's not that you have an allergic reaction to it, but it's causing an issue in the body somewhere along the road, whether that's in your gut, in your skin, in your moods, whatever. But we definitely see them fairly commonly in North America. Now, part of that is due to just how processed our foods are. So there's a lot of additives and a lot of things in it that may trigger a lot more issues than, in a different population. The most common triggers that we see: gluten, dairy, wheat, eggs, and corn. So those are typically the top food sensitivities that we're going to see in practice that are maybe contributing to a lot of people's issues. And again, it comes down to the processing of it. I always like to tell the example when I was doing my internship in Toronto. We had a patient that was celiac. So celiac is an actual allergy to gluten. Couldn't, have a crumb from anything, even if she used the same toaster as someone else. It caused her to flare up. She went to Europe on a family vacation, ate all the pasta, all the bread, not one issue. So that was a huge eye opener for me, realizing like, okay, is our food that processed over here that we're having someone have celiac and they can go across seas and not have a reaction? So a lot of that comes down to that. So I find a lot of people think like with naturopathic medicine, you're going to come see us and we're going to tell you to take out gluten, dairy just because we think it's bad. But it's not necessarily that it's bad. It might be bad for you as an individual, if it's causing you health issues, but it's also how processed it is and how different it is here compared to other places too. So interestingly, there's actually not quite a few, but there's enough studies out there in relationship to food sensitivities and autism spectrum disorder. So most of the research has been done on gluten and dairy, with actually fairly promising evidence. And we'll talk kind of about the gut health. I'm just going to kind of get into it right now, but what they find is that they notice an increased permeability in the body so that more foods can easily get into our system and trigger a cascade of immune responses. So you may have heard the term leaky gut before. So that comes down to your gut permeability. Now I have a little photo here too. So what we consider leaky gut is like what your gut integrity is. So, how strong is your gut? So on the left side here, we can see a normal, healthy mucosal lining. These little cells that are there have these little tight junctions between them, and they let certain things out and certain things in, and keep your gut working and keep your body feeling good. And then on the right side, we actually see what a leaky gut would kind of look like. So those little tight junctions that were there are starting to separate. There's reasons for that happening. So there's triggers for that might cause a lot of damage in the intestinal wall. So I liked this image because it kind of looks at everything that we would definitely consider from naturopathic perspective. So dietary proteins, so that would come like your gluten and your dairy, for example. So casein, which I didn't say earlier, but casein is the protein that's in dairy that a lot of us have sensitivities to. So that would be one of those dietary proteins. Low stomach acid. Now I'm not going to get too much into that because that's a whole other topic too. But a lot of times we actually see like heartburn, for example, is actually caused by not having enough stomach acid. So you're not producing enough to break down that food. So it's causing havoc on your digestive system. Antibiotics are a big one. They're going to wipe out a lot of your good gut bacteria, and we'll talk about that in a little bit. Infections, blood sugar issues. So I've talked about blood sugar a lot, about how, that quick spike and that drop is going to cause chronic health issues down the road. This is one of them. Pregnancy just can happen. Your gut flora is going to get thrown off. Stress, and we'll talk about that in a little bit too, but stress is a huge factor. It can actually change your gut microbiome just from having chronic stress. Menopause, a hormonal relationship there, different toxins in the environment and in your body, and then food allergies as well. So with this little cascade, what happens is these foods and these particles and whatever it is start to actually get into our bloodstream. So that little tight junction loosens. Those foods get those things get a lot into our bloodstream a lot easier, and they start to circulate. And this can reach through the blood-brain barrier. This can trigger inflammatory response in the body. It could actually lead to autoimmune diseases down the road, and can cause malabsorption and nutrient deficiencies because you're not actually, don't know what happened. You're not actually absorbing things properly. So that comes back to play in the sense that, okay, in autism spectrum disorder, we actually see this as there's an increased amount of this. So we see more gut permeability in that population. And it actually found that 25% of participants who were all diagnosed with autism spectrum disorder across a multitude of ages did actually have issues with that gut permeability. It's also found that, and I think I might have that on my next slide. Yeah, okay. So we'll get into the gut microbiome. Sorry, something came. My light. There. So where was I? Okay. So your gut microbiome. So I've kind of talked about bacteria and that side of things. So your gut microbiome is basically the collection of microorganisms, including bacteria, viruses, fungi, everything that's within your gut and their actual genetic information. So this is what your gut flora, you may have heard, your good bacteria, your bad bacteria, all of that happens within our bowel. So this is essential for overall health. When we're younger, between the ages of about 1 year old and 8 years old, our immune system is actually developing in our gut. So that little mucosal lining also has a lot of immune system receptors in it as well. So if we think about that, if your gut health is not great, and maybe you've been on antibiotics a lot, maybe you had a lot of ear infections as a kid, for example, and you were on antibiotics for that every time, there's consistent evidence to suggest that, okay, you might have a poorer immune system response when you're older or at that time. And if it's never addressed, then that could lead to a lot of health issues down the road too. So in autism spectrum disorders, and relationship to our microbiome, so again, there's actually quite a bit of research out there in relationship to your bacterial components too. But what we find is that actually 50% of children diagnosed with an autism spectrum disorder have some sort of GI, gastrointestinal issue: constipation, diarrhea, abdominal pain, bloating, irritable bowel syndrome, all of those things. That's 50% of children. That's a huge number, 1 in 2, right? And that is something that is fairly consistent across the board. So what they actually found in this study, and this was done in 2019, so it was actually pretty recent, it's found that there's higher counts of pathogenic bacteria, so what we would kind of consider bad bacteria, and lower counts of beneficial bacteria in the gut microbiome of those diagnosed with autism spectrum disorder. So what this comes down to is how your body's going to kind of react to that type of thing. So if there's something we can do to help sort of balance those GI issues, then maybe that would help from a behavioral issue. So this is the study that kind of looked at that. So what they found was that the participants in the study that used, basically they had a few different methods that they used. So it was either one probiotic or a combination of two probiotics. So probiotic is something that has good bacteria in it. It's going to help heal the gut and help rebalance that flora. And from that perspective, what they found with treating these for 12 weeks, they found that there was a reduction in frequency of your GI symptoms. So a reduction in that constipation, diarrhea, irritable bowel, but they also found a reduced occurrence of certain behaviors. So in this study, they had a lot of measurements that they took sort of pre and post, and some of those were behavioral aspects of it. So whether that's hyperactivity, or if that's focus, or social aspects of things. So there was a patient actually in the clinic that they were 2 years old, I believe, and diagnosed with autism spectrum disorder. Nonverbal, non-social, all of those things. Ended up doing a few supplements, but also taking out gluten and dairy, and sugar too from their diet. And within, I think, a month or 2 months, they actually said their first word. So they became verbal from it. So it's complicated, but it can be very, very powerful. And this, I'm talking a lot about the child population with this, but this totally translates into adulthood too, right? If we didn't fix it when you were a child, then let's fix it now. Let's work on that and get your gut working, because it has just this huge connection to how you're maybe feeling overall too. So this kind of brings me to what we call the gut brain axis. So how our gut actually communicates with our brain. So the gut has actually been coined a term as the second brain, because there's so many receptors in there that have a contribution to everything in our health, our behavior, our physiology, our immune system, everything. So it's a two-way communication. And if one's not working, the other one's not going to work. So a lot of this comes down to your microbiome. If your microbiome is thrown off, so if there's not a lot of those good bacteria and more of those bad bacteria, then we'll sometimes see behavioral issues come with that. So there's a ton of research on this now, and it really connects how I like to use the example, and I'll probably talk about this later too, I guess, but like, nervous poops, for example. So you have to do a presentation or exam or whatever it is, and you need to run to the washroom right away. That's your brain and your gut communicating. It's your brain realize, like, oh goodness, I am anxious, I am stressed. Let's send that signal to the bowel and let's everything release. So it's a stress response, right? And it just shows how strong that communication is. Now, another really interesting fact is that in the gut, there's actually about 95% of our serotonin in our body is produced in the gut. So in the intestinal walls where those receptors are, 95% of serotonin. Serotonin, if you're not familiar with it, is our happy hormone. So a lot of like antidepressant medications and things like that are used to try to increase your serotonin. So if you're taking an antidepressant and you haven't seen a huge change, but you also have all these bowel issues going on, then okay, let's focus on that as well as trying to increase your serotonin. But if you're trying to increase it and you're not kind of solving the root cause of that, then you might not see as much of a benefit. So I came across that fact when I was doing a presentation a few months ago, and I didn't actually realize how big of a percentage that was, and how much of a connection there is with that. And so, how the gut and the brain actually communicate is through a cranial nerve called the vagus nerve. So, it's one of the longest cranial nerves in the body. It basically innervates from our mouth down to our digestive system. So, these are some of the things that it can control. So, it can help control how your food actually gets sent down through the muscles, can conveys information from your organs up to your brain, responsible for your speech muscle movements too. It can lower blood pressure, and we'll talk about that in relationship to stress, controls your digestion, and it's actually responsible for making you feel full. It can cause fainting when overstimulated, and that kind of just, we'll talk about that in a minute, not as important, but just wanted to give a little introduction about what that is. There's more and more research coming out with this of how it's related to your gut, and then also how it can relate to mental health too. So I like this kind of image because it looks at our sympathetic and our parasympathetic nervous system. So in our body, we have our central nervous system, but then we also have something called an enteric nervous system. That's the nervous system that's in your gut. So that's where all the little receptors for, a lot of nervous system, a lot of neurotransmitters like serotonin, that's where they all lie. So that's called our enteric nervous system. So within that, we also have this sympathetic and parasympathetic nervous system. So parasympathetic is our rest and digest. So you may have heard the words rest and digest and fight or flight before. So rest and digest means, okay, we're relaxed, we're not stressed out, things are good. And during that period, your vagus nerve is activated. So when it's activated, you're getting salivation in order to induce your digestion. Your heart rate's normal. You can breathe properly. You can stimulate your digestive system. So stimulate that release of stomach acid and enzymes and things in order to help break down your foods. Stimulate your intestinal activity. So stimulate your digestive system, and make sure that your food's moving through properly, and proper absorption, proper breakdown, and all of that, and proper bowel movements with that. Then we have the sympathetic. So this is our fight or flight. So this is what, when we think about being in a dangerous situation, for example, you're threatened, there's a bear in front of you and you need to run. Your fight or flight response comes in. It's going to send blood flow to your extremities and help you run away from the situation. When we think about, and we'll talk about this in a minute too, but when we think about chronic fight or flight, we think about chronic issues here, right? Chronic where this vagus nerve is actually inhibited. So it's not working as well when we're in that response. This is obviously a survival method of our body, and it works wonders, again, when we're in that threatening situation. But it inhibits your salivation, it inhibits your digestive system, it inhibits that release of stomach acid, those enzymes to break down food. It actually inhibits your intestinal activity, so it shuts that down. So again, that nervous poops would be this would be a good example of that. Your bowels are letting go because there's no longer activity sent there, so they're just going to release. They're not going to work the way that they should. So I just wanted to kind of, again, these are things I could talk about for hours, but just to give you guys a little introduction to those types of things, so maybe it doesn't sound as confusing or complicated. But how the vagus nerve is actually related to our mental health. So vagus in Latin means wanderer. So it shows, as I mentioned, how it travels through the body, how it's really in charge. It's our longest cranial nerve. Now there's vagal tone, which is your activity of your vagus nerve. So higher vagal tone means more parasympathetic, which is this side of things. So we want that side. We want to be in that mode all the time, other than when we're in a threatening situation. So more parasympathetic nervous system action, your body's able to relax and come out of it after a stressful situation. So the researchers have actually discovered that there's a positive feedback loop between high vagal tone, so high vagal tone being a good thing, positive emotions and good physical health. So in other words, the more emotions, a lot of people just aren't aware of what this does and how it works. So there's actually ways to activate your vagus nerve that you can do on your own without having to take a supplement or do a test or anything like that. And this is kind of a list of certain things that we might recommend for patients. Stunts the body a little bit, but then you're able to relax afterwards. So having a cold shower, now humming and singing and chanting and gargling. So when we think about that, all those things are kind of innervating this area, which is where that vagus nerve really plays into. So singing in the shower, take a cold shower and sing your favorite tune, and maybe that'll help just re-stimulate that and see how you feel after. Typically we do feel pretty good after we have a nice little singing in the shower session. Deep breathing, so focusing on slowing down that nervous system response. How do we slow down? How do we bring it down? Get back into that parasympathetic nervous system response. Meditation. So I'll talk a little bit about meditation after, because it's just such a powerful tool. But again, it comes down to that deep breathing and just bringing your nervous system down a few notches. Improve your gut flora. So there is research there to say that poor gut flora leads to poor vagal tone. So if we improve that, we might be able to improve your vagus nerve activity too. And socializing and laughing, again, that comes down to like talking and laughing and all those things that are going to kind of innervate that whole area. And it makes us happy. So it releases that serotonin too, right? So there's a win-win. So I've mentioned stress a few times, and again, I apologize if this is choppy, but I'm just trying to kind of get through everything that I can. So stress is definitely a normal response. So again, that fight or flight response, we do need that to survive, right? If we're in a dangerous situation, we want our body to respond that way so that we can run away from a bear if we have to. The issue is that if we're under chronic stress, so maybe that's a few weeks of chronic stress, maybe that's a year, maybe it's 10 years, whatever it is, eventually we get stuck in that survival mode. So we get stuck in fight or flight. And when we go back to all the things that can happen in that sympathetic, that fight or flight response, all those things become like permanent in a sense. So we see poor digestive health over time. We see, lack of stomach acid. We see, maybe that restlessness feeling because your heart rate's always increased. Maybe you feel anxious because of it. And it's just, there's all kinds of factors that come into play with it when it comes to stress. So again, stress is also a very large topic. So I'm doing my best to kind of keep it as tight knit as I can. But you're just become in survival mode for too long. So we use the saying a lot, like wired and tired, like your body's running on empty. It's go, 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 go all the time. And we don't take the time to slow down and let it actually recuperate from that. So when it comes to stress, what happens, we have a hormone called cortisol. So that's our stress hormone. And it's secreted from our adrenal glands. So our adrenal glands sit on top of our kidneys, and they have a bit of like a negative feedback loop. So that production increases during times of stress. So when we're running away from that bear, we want our cortisol to go up and all of that cascade of events to happen. When we have chronic stress, that leads to chronic elevated cortisol. This is not good. We don't want to have cortisol high all the time because it's going to lead to a lot of health issues over time. So these are just a few, and I mean, there's so many out there that we can kind of tie back to your adrenals and your cortisol when it comes into your overall health. But we can see it shut down your digestive system, which we've kind of touched on, can increase your blood pressure. So we see a lot of times someone's really stressed out for a long time and they end up on a blood pressure medication because they can't control it, because the cortisol is controlling it at that point, and there's not much that you can do to potentially bring that down other than take the stress out of your life, which a lot of us can't do. Or we have to get on or really focus on like meditation and deep breathing all the time and just slow our lifestyles down as much as we can suppress thyroid function. I'm not going to touch on thyroid today, but connection here with the adrenals delays ovulation, so a lot of hormonal issues. So infertility, for example, is sometimes a big issue when it comes to chronic stress. Raises your blood sugar. So again, we've talked about that. Cortisol has a very close, you're in that danger situation. But when we think about that over the long term, it's not good. High blood pressure could lead to diabetes, obesity, cardiovascular disease, any of those things. So it's not a great thing. And then it can also impair your immune system too. So maybe you're getting sick all the time and you're really stressed out. And that's probably why, because your body just can't control your immune system. It's suppressed. It can't function the way that it can. It can't fight things off. So ways to maybe manage stress, very similar to some of the vagus nerve techniques. So deep breathing, meditation, and mindfulness. So slow down, learn how to be present in your life. Now this comes to daily life, but this can also come up to eating too. So we often recommend like mindful eating when it comes to food, because a lot of us eat in a rush. So if we think about eating in a rush and what that might do to our body, and when we think about that kind of, again, that like vagus nerve, that fight or flight response inhibits your digestion. It inhibits your release of stomach acid. So if we're eating in a rush all the time, our body never really has a chance to register that we're eating. So we don't get into that rest and digest phase, which can hinder absorption of nutrients. And, maybe you just put a huge effort into a meal and then you scarf it down and you don't even really get to taste it. So there's an example that actually my father, who's very into meditation and mindfulness, had introduced me to when he first kind of got into all of that, was eating a raisin mindfully. So taking a raisin, smelling it, touching it, thinking about where it came from, putting it in your mouth, kind of swishing it around, feeling the texture, then chewing it several times, and do it very, very slow, and just see what you notice. Does the raisin taste a lot better than it does when you shove the whole handful in your mouth? So think about doing that with your meals. Maybe pick one meal every day that you're gonna really just focus on eating slowly. So, taking a forkful and putting it down and chewing it and tasting it and then doing it again, because really your digestive process starts outside of the body. It starts with smelling your food, which triggers salivation, which then triggers your stomach acid and triggers the rest of the things that happen when it comes to digestion. So that's a very important factor in all of this. Walking, low intensity exercise, yoga. So if you're under a lot of stress and you do potentially have high cortisol issues, then we typically recommend more like low intensity type exercise, because really high intensity exercise is going to actually spike your cortisol, which in the short term is great. But in the long term, and if you're already dealing with this underlying issue, it's going to make those things a lot worse. Journaling. So I always recommend journaling with my patients, especially related to mental health concerns that come through the door. It's a great way, whether it's gratitude journaling or just a way to kind of talk about your day and get some stress off your chest. It's just a really good way to kind of, just reconnect with your body a little bit and work with your thoughts and understand how maybe they're contributing to how you're feeling. Proper sleep hygiene, which we'll touch on sleep real quick. I think I still got a little time. So we'll touch on sleep a little bit, and then healthy eating. So obviously, as I mentioned before, the idea of nutrition and how it's really related to your overall health. It's going to help your body manage stress better, as crazy as it might seem. But eating healthy is going to help your body adjust better in those times. It's going to help your cortisol stay more balanced, and it's going to help your blood sugar too. So there's all kinds of benefits when it comes to that. So meditation and mindfulness. So I don't know if any of you have practiced meditation before. Maybe you have. I believe there was maybe a talk on like mindfulness earlier today. I didn't have a chance to tune in. But if you haven't, if it's not something that you've ever tried or you've thought about trying or you're scared to try, start with a guided body scan meditation. Just someone telling you, like, relax your head, relax your shoulders, relax your stomach, just like a head to toe relaxation. Start small, start with like a 3 to 5 minute, ideally before bed, because that's when our body wants to unwind anyway. But start small, start with something very short. Meditation is a practice. It's not something that you're going to do one day and you're going to be an expert. It takes years to become an expert at it. I am still not an expert, I can tell you that. But really focus on it, and try to get it into your daily routine, because there's so many benefits when it comes to everything that I've talked about today with relaxing your nervous system, relaxing and increasing that vagus nerve activity, and really focusing on that. And yeah, it's just a good tool to have, even if you're having a really stressful day. Do a 30-second body scan in the middle of your day and just see, are you holding, and I am right now, are you holding your shoulders up to your ears? Everyone take note of yourselves right now. Are you feeling like this right now? Take a deep breath and let your shoulders drop. It feels good. And the more you do that, the more your body gets used to doing that too. And it just helps us reconnect. And again, it brings us into that rest and digest phase. So even doing that while you're eating, like taking a breath between each meal and just slowing things down. Really, the take home with that is slow down. We live in a society that is go, 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 and I'm guilty of it too. But we need to be aware that that does eventually have a fairly negative impact on our health, but especially our mental health too. If we're struggling physically from a lot of these issues, we're going to struggle mentally too. So these are some meditation apps that I always like to recommend to patients. Insight Timer is my favorite. It's the one that I pretty much use every day. I think they're all free. Calm might not be free anymore, but Insight Timer is for sure. And yeah, download them, or look on YouTube, whatever you need to do. But try it out. Try 3 minutes tonight and see how you feel and what you notice with it. And I can post those. I can send them to Brooke, and she can post them if she wants to. So sleep. So sleep is a pillar of health. So if we're not sleeping well, we're probably not going to feel well. So there is definitely a correlation between the amount and the quality of sleep that we get and your overall mental health and your mood. So there was a study done with college students. College students, fair amount of stress typically, or just maybe poor lifestyle choices and that kind of thing. But it was found that poor quality sleep was significantly and positively associated with increased rates of anxiety and depression. So that, again, is a huge factor. If we're not sleeping well, then that could be another trigger for our anxiety or depression or any other mental illness, or just a low mood or an anxious mood too. And when it comes to kind of bringing that back around to the stress aspect of things, we're dealing with a lot of high stress over time. That's going to trigger that high cortisol all the time, which is actually going to lead to poor sleep, because your cortisol won't know how to turn itself off at night, and you're maybe going to have like a restless sleep, or you're waking up and you're feeling wide awake. You're in that fight or flight mode all the time, so you just can't sleep properly. And again, in turn, that's going to maybe lead to poor mental health too. So if you're not a good sleeper or you don't have a great sleep routine, focus on that. If there's one thing you can kind of take away aside from eating healthy, and meditating, is try to get some sleep, because it's just such a core of everything that a lot of patients come through the door and they have these list of symptoms that are going on, and then we talk about sleep and they're like, oh, I don't sleep. I wake up like every hour and I don't get a sound sleep. I have a hard time getting out of bed. I'm like, okay, well, we need to first get you sleeping before we can fix anything else, because that's, again, it's a pillar of health, and it's probably the root of a lot of your issues too over time. If you haven't slept, it's going to lead to health issues too. There's even studies that suggest like poor sleep patterns associated with obesity too. So there's a lot of connections there. So in, a perfect world, in a sense, if you don't have a ton of stress, this red line is your cortisol. So typically in the mornings, it's going to start to increase. You get kind of your nice high just before lunch, and then it'll slowly taper off. So maybe you've hit that like 2 o'clock, 3 o'clock wall before. If it's really intense, like you need a nap and you can't get up, that's not a good thing. But every now and then we do have that, just like a little bit of a lower energy after lunch, and that can be normal. And then the blue line is actually your melatonin. So melatonin is what we call our sleep hormone. So these two are actually very inversely related. So when cortisol goes down, melatonin comes up. So when we think about that, and actually I'll touch on that in a second, I'm getting ahead of myself now. But you can see in this second half of during sleep. So I took a science of sleep course when I was at Dalhousie, and it was very interesting. I learned a lot of like weird facts about things. But they suggested that at night there's actually kind of a process of sleep of what your body is doing. So in the first, hour or so, we're trying to wind down. We want to have a sleep routine. We want to make sure that there's our body's getting that, signal to say, okay, it's time to go to sleep. Then within the first few hours of your sleep, say from like 10 p.m. till about 2 a.m. is when your body's physically repairing. So your muscles are relaxing, your bones are developing, all those kind of physical processes that can happen. And then in the last few hours of your sleep is your psychological repair. So that's a very interesting fact because I think maybe a lot of people don't realize that of how much of an effect that might have. So if you're not sleeping well, especially in that kind of last half of your sleep, then you're mentally not repairing yourself from that previous day or previous month or whatever it is that's going on. So it's very important. And when I learned this in university, but which really resonated with me is that those when we're in that kind of mode of cramming for something, like we have an exam the next day and we stay up all night and we study and we want to get everything done because we feel like, okay, if I study it right now and I write my exam in an hour, then I'm going to know everything. It's actually not great. You should really get like a full 8 hours of good sleep before an exam because that's when your body's actually going to take in all that information and store it and use it in a positive way. So a lot of that cramming is, it's very hard on your body from a cortisol perspective and you're not sleeping, but B, because of all the things that happen while we're sleeping. So when we throw stress into the picture, it definitely throws off our pattern. So this is kind of that pattern of high cortisol all day, where we don't really see that. We do see a little afternoon drop, but not a huge one. And then it's going to impair the rest of your sleep. So where I said that they're inversely related, as your cortisol um, as your cortisol drops, and again, like a perfectly unstressed out person, your cortisol drops at night, your melatonin is going to increase. But if your cortisol never actually drops properly, then your melatonin will never increase, which means you're not going to get a great sleep. Melatonin has a lot to do with like quality of sleep too, not just how long you're sleeping, but the actual quality of it. So a lot of times we look at that factor in that, and maybe you supplemented with melatonin and it didn't help you sleep, but maybe it's because your cortisol is too high, so your body's not actually signaling it to drop. So I don't know if that was complicated or not, but I tried to make it feel simple. So I figured I would end, and I had just done a program in relation to like nutrition and whole body health. And I found this mindset piece because I feel like from an overall health, whether it's mental health, physical health, physiological, whatever it is, that mindset is such a huge part of that so there's a fixed mindset and there's a growth mindset. So fixed mindset is that we're kind of stuck in our ways. We think that if we fail at something, we cannot get any better at it. You're either good at it or not. I don't like to be challenged. These are some of the quotes that are on there. When I'm frustrated, I give up. Feedback and criticism are personal. So in relationship to our health, a lot of that could come down to, let's use like nutrition, for example, or I'm not a big person. I don't love to talk about like weight loss and that whole thing, but like weight loss, for example, is a big part here. If we have a fixed mindset with that, it's never going to change. If we're on this strict healthy eating routine and then we fall off the wagon for a day and then we get totally down and out and give up, then you're never going to move forward with that. And that fixed mindset comes with everything, with relationships with people, with your mental health. If you're stuck in this mindset of I'm always going to be anxious or I'm always going to be depressed and there's no answers, I can't get out of this, then you're never going to get out of that, right? If you're not ready to grow, which brings us to that growth mindset, then you're not going to see those positive changes. And a lot of things, and I don't really want to get into all of that, but like the law of attraction, like what we attract, what we put out into the universe is what the universe is going to give back to us. So if we're putting out a lot of negative energy and negative self-talk to ourselves and all of that, you're going to get that back. You're going to get it back, and it's going to present probably potentially as a health concern. So that growth mindset is just changing your ways and changing how you talk to yourself. That failure is an opportunity to grow. So if I failed at something, or if you have a mental health illness and you feel like that's a failure, change that. It's not a failure. I mean, it's part of you. Like if you are someone that has always had anxiety or always had depression, it's part of you. It's part of your personality. It's there. It's you learning how to control that and grow from it. That's important. It's still going to be there. Again, it's not something to be ashamed of. It's not something that is a failure in any way, shape, or form. It's something that you can learn to grow with, and really use it to move you forward and motivate you to move forward. So again, some of the quotes on that. So like challenges help me to grow. So challenge yourself with certain things. Maybe that's meditation. Challenge yourself with doing a meditation tonight, or challenge yourself with getting a proper sleep routine in. Back to the sleep for a second, like sleep routine. I didn't really touch on that, and I meant to. It's really important because if you have the same sleep routine every single night and say that's like a half an hour before bed, you brush your teeth, you wash your face, you read or you do a meditation or you do some yoga or you journal, whatever it is, that sends signals to your brain that, okay, it's time to wind down. Let's start to increase your melatonin. And the longer you do that, after say 2 or 3 weeks of sticking to that routine, your body will eventually just automatically get that signal. So I think that part's very important too, of kind of working on a sleep routine. So maybe that's your challenge yourself to having a proper sleep routine and getting into that. And feedback is constructive. Like, when we get feedback from someone, use it in a constructive way. I'm inspired by the success of others. That's a huge one too. Sometimes I think we just kind of live in a society that I feel like we kind of push down others' successes sometimes. And I think getting out of that mindset of just realizing that, it's awesome. I'm so inspired by you for making these changes in your life. And then, yeah, I like to try new things. So again, maybe that's meditation. Maybe it's something that you've thought about or, you're not really into, but I'm going to force you to try it. So I just wanted to kind of add that in. I know it's kind of slightly unrelated to naturopathic medicine, but I just feel like it's such a huge piece. And I find it's a huge piece when it comes to treating patients, mostly mental health for sure, but so many other factors too with it. And yeah, I think that's it. I did pretty good for time. I was a little worried that I was going to be long.
You did awesome. It was wonderful. Wow. So I see just a few questions in the chat.
Okay, I couldn't tell. I was getting
It's hard. It's
notifications.
really hard.
I know. The Zoom world is complicated. I'm going to stop sharing my screen and then I'll pop and see if I can see. Okay. Let's see.
Might have to scroll up a little bit.
Dr. Derek McFaves. No, I'm not familiar. I will have to look into that, or I am, and the name's not ringing a bell. So I will look into that, Catherine. Food issues because of sensory. Yeah, for sure. Definitely. Like I said, there's so many connections when it comes to like food and autism. So, if you are a parent that has a child that's been diagnosed, maybe look into that, look at their diet a little bit and see like what are they eating that maybe is one of those common food sensitivities, or something that is maybe triggering it.
And a lot of compliments, so that's great.
I wasn't sure because I was like, this is either gonna be really boring or somewhat interesting.
Very interesting. Wow. Today we covered everything from mindfulness to employment, nutrition, exercise, trauma, housing, self-advocacy. We covered everything. So thank you, Colleen. That is amazing.
Yeah. Thanks for having me. I appreciate it.
That's awesome. Wow. By giving a quick thank you because wow, what a success today was for our first ever conference. It was very nerve-wracking for myself and I think for a lot of people today because it's just something we've never done before. And when you enter that territory where you feel uncomfortable, it can be very anxiety-ridden, but it was amazing. So thank you everybody for being so cooperative and thanking the technology gods for allowing the Wi-Fi not to completely quit today.